Hi, my name is Isabella. I'm a family nurse practitioner student, and today I'm going to be performing a GI, neuro, and musculoskeletal assessment. Today I have my fiance here with me. Would you please be able to tell us your full name and date of birth?
Dominic Bryant, February 4th, 2000.
Okay, so Dominic, do you know where we are today?
New Jersey.
Do you know why we're here?
An exam.
Do you know what year it is?
2026.
Okay, we're starting off with a general survey. The patient is A&O times 4. His mood and affect is appropriate for the setting. He is dressed appropriately. He is well groomed. His skin color is appropriate for his ethnicity, and there are no signs of acute distress at this time. So first we're going to be starting with the abdomen. So I'm going to have you lay flat on your back. So for inspection of the abdomen, I'm noting that the abdomen is symmetrical. There is no distension. The abdomen is flat. There are no signs of scarring. There are no lesions. There are no extra pulsations, no peristalsis, even hair distribution throughout the body. The umbilicus is midline. It is not herniated. There is no swelling. All normal findings. So now I'm going to be auscultating the abdomen. I'm going to be starting in the right lower quadrant. I'm going to be listening to the bowel sounds using my diaphragm. So right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. I heard approximately 5 to 30 bowel sounds per minute in all 4 quadrants. This is a normal finding. The bowels are reactive. Now I'm going to be listening to the vasculature of the abdomen. I'm going to be using my bell. So we're going to be starting off with the abdominal aorta, approximately 2 to 3 centimeters above from the umbilicus. Okay, so no bruit noted there. Then I'm going to be moving on to the renal arteries, starting off on the right side, so the right renal, left, no bruits bilaterally, moving on to the iliac arteries on the right side, left side, no bruits noted. Then the femoral arteries, right side, left side, no bruits noted. All normal findings. Now I'm going to be percussing the abdomen. I'm going to be going in that same order, so we're going to be doing the right lower quadrant, right upper, left lower. Okay, so I heard tympany throughout all 4 quadrants, which is an expected finding because the abdomen is filled with the intestines that are filled with air, so we're going to be hearing that tympanic sound. Now I'm going to be percussing for the liver. So in order to find the liver, I'm going to go to the right side of the patient, mid-clavicular line, and then start percussing downwards. So I'm going to be hearing that resonant sound over the fields of the lungs. Then I'm going to take note when I start to hear dullness. Mark the patient. Then I'm going to be percussing upwards from the right lower quadrant. I'm going to be hearing the tympanic noises, and then I'm going to take note when I hear the dullness again. Okay, marking that on the patient. So that's about 7 centimeters for the liver, which is completely normal. We're looking for 6 to 12 centimeters for the liver. Now I'm going to be percussing for the spleen. So in order to find the spleen, I'm going to go to the left side of the patient, anterior axillary line, and then I'm going to be percussing downwards. Hearing the resonance over the lung fields. And then that dullness for the spleen. Good. Normal findings. Now we move on to palpation of the abdomen. So I start off with light palpation using one hand. I'm going to be going about 1 centimeter deep, starting off in the right lower quadrant again. Let me know if any of this hurts. Okay, so I'm not feeling any masses. The patient's not grimacing. The patient's not in pain. Expected findings. Now I'm going to be moving on to deep palpation, 5 to 8 centimeters deep, using both of my hands. Let me know if any of this hurts again. Okay, so I did not feel any enlarged organs, didn't feel any deeper masses, no deformities, patient was not in pain, all normal findings. Now I'm going to be palpating the abdominal aorta, so I'm going to be going about 2 to 3 centimeters above the umbilicus again. Feeling that pulsation, and then going outwards until I stop feeling it. So it's about 3 centimeters in width. normal findings. Also let me know if any of this hurts. Now I'm going to be palpating for the liver. So I'm going to go back to that right side. I want you to take a really big deep breath in and then hold it. Good, so I'm feeling that edge of the liver. The liver is not feeling enlarged. The patient's not in pain while I'm palpating the liver. The edge of it is palpable, but it's not enlarged. Now I'm going to be palpating for the kidneys. So this is a two-hand technique. I want you to take a big deep breath in again. One hand's going to go under your back and then one's going to be on your abdomen. Okay, so kidneys are not palpable. I'm going to do it on the other side now. Big deep breath in, hold. Okay, kidneys are not palpable. There's no tenderness, there's no swelling. Patient's in no signs of discomfort. Now I'm going to be palpating for the spleen. So the spleen's on that left side. Take a big deep breath in again. Good. Okay, spleen is not palpable. Patient's not in pain. No signs of tenderness. These are all expected findings. We don't want any of these organs to be too enlarged, but we do have to just take note of where they're expected to be. So now I'm going to be moving on to the upper extremities of the patient. So I'm going to ask if you could just sit up. So I'm inspecting the upper extremities. So I'm looking at the patient's shoulders. They appear to have even muscle tone, even bulk. They are symmetric on both sides. The clavicles are symmetric. There's no drop off. The scapulae is also symmetric. It lays flat against the thoracic wall. Now I'm going to be palpating the joints of the upper extremities. I'm going to be starting with the shoulders. So I'm just going to be moving you while I do this. Okay. So no swelling with the shoulders, palpating those joints. Now we're going to be moving on to the elbows. Good. Checking everything bilaterally. Good. Moving on to the wrists. Good. And then the fingers. Okay, so there's no tenderness, there's no swelling, no redness, patient's not in pain, everything was movable, nothing was swollen, all expected findings. Now I'm going to be palpating the brachial pulse of the patient bilaterally. Good. +2 bilaterally, then the radial pulses. +2 bilaterally. Now I'm going to be checking the reflexes of the patient. So we're going to start off with the bicep reflex. I want you to flex your muscle for me. Good. So I'm going to feel that bicep tendon with my thumb. Good. So we saw the contraction of the muscle and the movement from the hand. +2 on this side. So I want you to make that fist for me again. Good. Relax. Good. So we saw the contraction and then the flexion of the hand. Now we're going to be doing the brachial radial arteries. So these are located over here. So find that radial. All right, just relax your hand. Good. On this side. Good. +2 bilaterally. So now we're going to be testing the tricep reflex. So I'm going to assist you with this one. I want you to just relax your arm. I'm going to feel for that notch above the elbow. Good. Relax. Okay, +2 bilaterally with that. Now I'm going to be checking the patient's range of motion. So first we're going to start off with your neck. So I want you to put your chin to your chest. Good. Extend your head backwards. Put your head back in the midline. All right, now I want you to turn towards my hand. Good. Then turn towards my hand again. Good. Even strength on both sides. Then I want you to put your left ear to your left shoulder. And then the same thing on the other side. Good. So range of motion is intact for the neck, even muscle tone. Now we're going to be checking the range of motion for your shoulders. So I want you to put your hands out straight. Put your hands out side to side. behind your back, behind your head, and then behind your back. Perfect. Muscle tone, range of motion, everything is equal, smooth. Now we are going to be testing the range of motion for the elbows. So I want you to flex your elbows up, extend them out, put your hands straight like this, flip them upside down. Good. So range of motion is intact for every aspect of the elbows, the shoulders, and then the neck. Perfect. So now we are going to be moving on to the lower extremities. So I'm just going to be looking at the lower extremities. I'm looking at the skin color, the musculature, everything appears to be even. No signs of deformities, no masses. So now I'm going to be palpating the quadricep muscles. Good. So even tone on both sides. Now we have the hamstrings. Good, even tone, even musculature. The knees, bony prominences. I'm not feeling any masses anywhere. There is no swelling. Now we're going to be feeling that tibia bone. Good, even on both sides. Then the calves. And then we have the Achilles tendon. Good, everything appears to be even, symmetric, perfect. And then we're going to be looking at the patient's ankles, so there's no swelling noted. Can you move your feet up and down for me? Up and down, and then rotate them. So the ankles, range of motion, everything is symmetric, even, intact. Now I want you to lift your legs up one at a time. Good, lift it up. And then try to go against my hands, and then like bend it back. Good. Good. Force, do the same thing on the side. Good, go back. Good. So even strength on both sides. The patient has good range of motion. Are you able to lay back? I just want to see some musculature and range of motion of your hips. So bring your right leg all the way back and then rotate. Good. Extend it back out. Good. Do the other side. Extend. Good. Bring it back. Good. So range of motion is intact. Everything is expected. I'm going to have you sit up. I'm just going to test some of your reflexes. So for this, I need your legs to be dangling. Good. So this is going to be the patellar reflex. We're going to find that notch in the patient's knee. So when hitting this, the goal is for the leg to come back up. Good. Good. +2 bilaterally. Now we're going to be doing the Achilles tendon and plantar reflex test. So I'm going to be finding that Achilles tendon back here. I'm going to be flexing the patient's foot up. All right, ready? Good. So we saw the patient's foot flex down when I hit the Achilles tendon. Same thing on this side. I'm going to flex it up. Good. So reflexes were symmetrical on both sides. Good movement. Everything felt exactly the same. All normal findings. So now I'm going to be looking at the spine of the patient. So I'm going to have you turn your back towards me. So I'm looking at the spine. The spine is straight, normal curvature. There is no signs of scoliosis. The shoulders and the hips are like aligned with the spine. Everything is normal. Now I'm going to be palpating the spinous process on the back. So I want you to tilt your head downwards. Okay, now tilt it up. So I'm looking for that movable vertebrae, the C7. So I want you to put your head back down. Good. So I'm feeling for C7. Then I'm palpating up. So I'm palpating that cervical vertebrae. Then we're going to palpate down. We have T1. And then we just move down. Perfect. And then we're going to be feeling for the muscles. Good. So even muscle tone on both sides. Patient's not in pain. No deformities, no swelling, no masses. Everything is intact back here. So I'm going to have you tilt to the front again. I want you to bend all the way forward. Bend backwards. Okay, tilt your body to the right. Tilt your body to the left. Good. Perfect. And then I want you to test the movement of your trunk. Good. So good movement, good muscle tone, everything is symmetric, everything is even, all expected findings. Now we are going to be doing some seated tests to test the neurological functions of the brain. So first we're going to be starting off with the rapid alternating movements test. So for this test, I want you to match your thumbs to each single one of your fingers. Go as fast as you can. As fast as you can. Good. So movements are coordinated. They are symmetrical. They are smooth. To be expected. Normal findings. Now we're going to be doing the heel to shin test. So with your right heel, I want you to put it at the top of your left shin and then just move it downwards. Good. Do the same thing on the other side. Down. Good. So symmetric findings on both sides, well coordinated, well balanced, to be expected. Now we are going to be moving on to the exteroceptive sensations test. It is testing temperature and it is testing for pain. So for this test, I'm going to have you close your eyes. So I'm going to place an object on your body. I want you to let me know where I'm placing it and if it's cold or if it's warm. Ready?
Cold.
Okay, where did I put it?
Left forearm.
Okay, we're going to do a different object.
Warm.
Okay.
Right bicep.
Good. Perfect. So temperature sensation is intact. Now we're going to be going on to pain sensation. So I want you to close your eyes again. All right, I'm going to touch you. Let me know if it hurts and let me know where I'm touching you.
Sharp, left hand.
Okay.
Not sharp, right bicep.
Perfect. So sensations are intact for temperature and pain sensations. Now we are going to be moving on to testing the patient's other sensations. So I'm going to have you close your eyes. Okay. So for this test, I want you to just let me know basically what I'm doing.
Middle finger up.
I moved it up?
Yes.
Okay, that was correct. Okay.
Left foot up.
Okay, good. Those are the proprioceptions. Now I'm going to be testing the vibration aspect of this test. So I'm using my tuning fork. Keep your eyes closed.
Vibrate.
Where?
Left pointer.
Okay.
Vibrate left big toe.
Perfect. So the patient's sensations are intact. Now we're going to be moving on to the cortical sensations. So the first test that we're going to start off with is called stereomegaly. I'm going to be placing an object in your hand. I want you to keep your eyes closed and then just tell me what I'm putting in your hand.
Pen.
Okay, that is correct. Now I'm going to be moving on to the next test. It's called graphesthesia. So basically keep your eyes closed again. I'm going to be tracing either a number or letter in your hand and I just want you to let me know what it is. Ready?
3.
Perfect. That sensation is intact. Now we are going to be moving on to the 2-point discrimination test. So for this test, you're going to let me know where you're feeling the sensation and if it's 1 point or 2 points.
Okay.
Okay. Ready?
Mm-hmm. I felt it here and it was 2.
Okay, 2 points.
Yes.
Okay. And then we're going to move on.
Here and it was 1.
Okay, that's correct. Now I'm going to be doing the extinction test. So I'm going to be touching you again. I want you to just close your eyes. Tell me where I'm touching you and then how many points. Okay, ready? Close your eyes.
1. Face.
Okay.
Both shoulders. 2.
Okay. Perfect. So that is intact, all expected findings. So now we're going to be doing some standing tests. So I'm going to have you stand up. I want you to walk for me, so just walk over there. Good. Now walk on your tippy toes. Walk on your heels. Now walk heel to toe. The patient's gait is intact. even symmetric movements, no signs of being unsteady. Everything was expected and normal. So now we are going to be doing the Romberg test. So for this test, I want you to close your eyes, feet together, hands at your sides, and just close your eyes. I'm just going to be noting if the patient is swaying back and forth at all, and I'm not seeing any swaying. Perfect, to be expected, normal findings. Now we're going to be going on to the Pronator's drift test. So for this test, I want you to keep your eyes closed, put your hands out in front of you.
Mm-hmm.
Good, that's all you have to do, and I'm just noting if I see any movement back and forth, if you're steady, and you are. So that was perfect, all expected findings.